Assalamu alaikum. Good evening, everyone. I'm Dr. MD Riyad Hassan, Organizing Secretary of the Australia Bangladesh Health Forum ABHF. On behalf of ABHF, I would like to warmly welcome all of our participants joining us today for ABHF Compass Webinar 5, OPRA Exam, a complete roadmap for overseas pharmacists. Thank you for taking the time to be with us. We are delighted to see pharmacists, pharmacy students, and healthcare professionals joining from different parts of Australia and also from Bangladesh. Before we begin, I would like to briefly introduce our organization. Australia Bangladesh Health Forum ABHF was established with a vision to create a professional platform for Bangladeshi origin healthcare professionals in Australia. What started as an initiative among a group of doctors has now grown into a multidisciplinary organization that includes pharmacists, dentists, nurses, allied health professionals, academics, and other healthcare professionals. Our mission is to promote professional development, networking, mentorship, knowledge sharing, and community engagement. Through our webinar series and educational activities, we aim to support healthcare professionals at different stages of their careers and help them navigate their professional journeys in Australia. Today's webinar is part of that ongoing commitment. Without further delay, it is now my pleasure to invite Dr. Samia Arifin, our Educational Secretary of ABHF, to introduce our speaker and outline the objectives of today's webinar. Thank you. Over to you, Dr. Samia.
Assalamu alaikum, everyone. Thank you, Dr. Riyad Hassan, for your kind introduction. I am Dr. Samia Arifin, Education Secretary of the Australia Bangladesh Health Forum, in short ABHF. And I would like to warmly welcome all participants joining us today for ABHF Compass webinar number 5, OPRA Exam, a complete roadmap for overseas pharmacists. We are delighted to see such a strong interest from pharmacists, pharmacy students, and healthcare professionals who are interested in pursuing a pharmacy career in Australia. Today's webinar has been designed to provide practical guidance on the Australian pharmacist registration pathway, including English language requirements, skill assessment, and the OPRA examination, internship training, registration requirements, and career opportunity in Australia. We are privileged to have Mr. Mohammad Zakaria Hossain with us today. He is an experienced consultant clinical pharmacist and diabetes educator. Mr. Hossain currently works as an independent contractor with Embedded Health Solutions, providing medication management and clinical pharmacy services across the aged care and community sectors. He brings extensive experience in medication management, chronic disease management, and pharmacy practice in Australia. We are confident that today's session will provide valuable insights and practical information for anyone who is considering a pharmacy career pathway in Australia. Before we begin, I would like to remind all our participants that we will have a question and answer session at the end of our presentation today. Please feel free to write your questions in the chat box throughout the webinar, and we will try to answer as many questions as possible during the discussion session. Now, without further delay, it is my pleasure to invite our speaker, Mr. Mohammad Zakaria Hossain, to deliver today's presentation. Over to you, Mr. Zakaria Hossain.
Assalamu alaikum and good evening to everyone. Thank you very much, Dr. Samia Arifin Apu and Dr. Riyad Islam Bhai, for your kind words, and a humble gratitude to all the members of the ABHF for organizing such a beautiful community event, and also organizing this seminar where we can talk about webinar, where we can talk about the pharmacy registration process. And today I'm very happy to see a lot of interest from the students and the young people who has recently completed the pharmacy education in Bangladesh, and also they have done in few of them are in Australia, and all of them have a question about the OPRA. So today's session is going to be based on my experience. So before I start, I'd like to make an important disclaimer. The information and opinions presented today reflect my own personal understanding, professional experience, and views. This is a general educational presentation only. It is not official, legal, migration, registration, financial, or employment advice. For official information about OPRA, eligibility check, skill assessments, examination fees, and examination requirements, the Australian Pharmacy Council, in short, it's called APC, is the authoritative organization. For provisional registration, supervised practices, English language requirements, registration examination, and general registration, candidates must follow the requirements of the Pharmacy Board of Australia and the Australian Health Practitioner Regulation Agency, commonly known as APRA. Migration and visa decisions are made separately by the Australian Department of Home Affairs. Passing OPRA or obtaining a skill assessment doesn't automatically guarantee registration, employment, or a visa. Fees, examination structure, English language scores, laws, and registration requirements may change. Therefore, every candidate must confirm the latest information directly from the relevant official authority before applying or making any financial decision. Now, I would like to start the webinar on presentation. And as Dr. Sami Arifin said, my name is Mohammad Zakaria Hossain. I work as a clinical consultant in aged care industry. Today, I'm delighted to discuss one of the most important topics for internationally qualified pharmacists who are considering a professional career in Australia. The title of today's presentation is Decoding OPRA, the Overseas Pharmacist Readiness Assessment, and Your Pathway to Australian Registration. For many internationally qualified pharmacists, Australia represents a major professional opportunity. It offers a highly regulated healthcare system, a strong focus on medicine safety, multidisciplinary care, and gradually expanding scope of practice for pharmacists. However, the registration process may initially appear complicated. Candidates hear different terms such as APC assessment, OPRA, AFRA, provisional registration, supervised practice, intern training, written examination, oral examination, and general registration. Today, I'll simplify the process and I'll explain them. So today we'll discuss about what OPRA is, who generally needs to complete it, how it differs from the sorry, I just jumped one slide. Okay. So what subjects are assessed and why this presentation matter? Many internationally qualified pharmacists uh, are academically strong. They may have studied pharmacology, medicinal chemistry, pharmaceutics, biopharmaceutics, biochemistry, microbiology, and therapeutics in considerable detail. However, success in the Australian pathway requires more than holding a pharmacy degree. Candidates must demonstrate that their foundational pharmaceutical knowledge is sufficiently current and that they can apply it safely to medicine selection, dose calculation, monitoring, adverse effects, interactions, and patient care. So the presentation is particularly relevant to the pharmacists from Bangladesh, India, Pakistan, Nepal, Sri Lanka, Middle East, Africa, and other countries that generally enter through the APC knowledge stream. One of the most common mistakes is to begin preparation without first understanding the official assessment structure. Some candidates purchase multiple books, join several courses, and memorize thousands of medicine facts. However, they do not have a structured plan. So, having a better plan, a structured way, and understanding the OPRA process is the main important part. So, there are few steps involved. So I just need to. Okay. So the first step is assessing the uh, degree assessment, where your pharmacy degree assessed by the Australian Pharmacy Council. For this stage, the first, you have to scan, you have to create an account to the Australian Pharmacy Council, then scan and upload your educational qualifications. You don't need the registration in your country of study, but or residence, the first country where you have obtained your registration or your study, but it will be needed later on. So when you upload those documents with your ID, Australian Pharmacy Council examines whether the qualification meets its academic requirements and whether the candidate is eligible to proceed to OPRA. This is an important distinction. This is an important distinction. The APC assessing your qualification and readiness to progress. It is not granting pharmacist registration. Stage 2 is the eligibility. So if Australian Pharmacy Council assess your education as Australian qualification and it is ready for your OPRA, then they will grant you the eligibility to sit the OPRA exam. Now, when you get the letter from the Australian Pharmacy Council, they will allow you to sit for the OPRA exam. So when you pass the OPRA exam, which is the Overseas Pharmacist Readiness Assessment, the next step is provisional registration, where you will be required to pass an English test, and then you have to get your provisional registration from the Pharmacy Council. Now, the English requirement changes. So the best idea when you pass or any information regarding any of these requirements, please first check with the authoritative organization rather than asking anyone else, because the score and other things get changed. Now, when you get your provisional registration, you will have to finish a certain hours under some senior pharmacist, which is called the supervised practice. And when you finish the supervised practice, you have to appear another exam, which is called written exam, which is another MCQ exam. And this will be conducted by the Pharmacy Board of Australia. And also there will be a presentation or a viva where you will be asked few questions from the different moderator and you have to answer them. Then that part, when you finish, you get your general registration. Now, provisional and registration and supervised practice, this doesn't guarantee you will be getting the registration. So this is one of the processes that you have to go through. Now, when you finish all these exams, then you have to apply for your general registration. And general registration is the final process. To become eligible for general registration, pharmacy interns must successfully complete the approved intern training program, the required supervised practice period, and the board's written and oral registration examination. Only after satisfying all applicable standards can the person apply for general registration and practice independently as a pharmacist in Australia. Now, the pathway is not simply pass OPRA and become a pharmacist. The correct concept is qualification assessment, OPRA exam, skill assessment outcome, provisional registration, supervised practice, intern training, registration examination, and then general registration. Regarding the English language requirement, please check with Australian Pharmacy Council and Australian Health Practice Regulatory Authority for the correct score required. Now, the next slide I go to is the gatekeeper. What is OPRA? OPRA stands for the Overseas Pharmacist Readiness Assessment. It is the current Australian Pharmacy Council examination used to determine whether eligible overseas qualified pharmacists have the necessary understanding of biomedical, pharmaceutical, and clinical sciences to progress towards pharmacist registration. OPRA is an important assessment, but it is only one component of the full pathway. It doesn't grant a visa. It doesn't grant general registration. It doesn't guarantee an internship. It doesn't guarantee employment. What it does is demonstrate that the candidate has met the required examination standard to progress towards provisional registration and supervised practice. Who generally needs OPRA? As I said, that the APC knowledge stream applies to candidates who have completed an eligible pharmacy qualification in country other than Australia, Canada, Ireland, New Zealand, and the United Kingdom or the United States. However, individual circumstances may differ. Candidates should never select their pathway solely on the basis of nationality. The relevant factors include whether the qualification was completed, the nature and duration of the qualification, and the APC assessment criteria. Now, OPRA is the current Australian Pharmacy Council examination assessing whether internationally qualified pharmacists possess the clinical reasoning required for registration. So basically, Australian Pharmacy Council will let you know whether you are eligible for OPRA or not, and they are the only authority to grant and let you sit for the exam. Now, there is a question commonly asked or discussed by a lot of overseas pharmacists, and I have been asked several times this question. Is OPRA just the new name for CAPS? OPRA is substantially different examination. It marks total departure from the memorization of the past, introducing a rigorous new focus on real-world clinical practice, patient safety, and pharmacist decision-making. CAPS was the former knowledge assessment of pharmaceutical science, and OPRA replaced it with a revised blueprint and a greater allocation to therapeutics and patient care. But factual knowledge remains extremely important. OPRA should not be treated as simply a renamed CAPS examination. You must still know mechanism of action, adverse effects, contraindication, important interactions, pharmacokinetic principles, toxicology, physiology, pathophysiology, then dosage forms. You should be able to connect the medicine to the patient. You should be able to recognize why a medicine has been selected and what could make it unsafe, how the dose may need to change, and what outcome should be monitored. So the correct message is you need strong factual knowledge, but that knowledge must be organized so that you can understand and apply it clinically. So the assessment shift from CAPS versus OPRA. The former CAPS examination was commonly perceived as being heavily focused on knowledge recall and pharmaceutical sciences. OPRA gives the largest single allocation to therapeutics and patient care. The practical implications are significant. When studying a medicine such as enalapril, it is not sufficient to remember only that it is an angiotensin converting enzyme inhibitor. What you need to know as well is why it may be selected. It is its major contraindications, its effect on blood pressure and renal function, the risk of hyperkalemia, what monitoring may be needed, how it may be interact with other medicine, what counseling should be provided, and when treatment may need to be withheld or modified. Similarly, when studying an anticoagulant, do not only study its mechanism, you should consider bleeding risk, renal function, age, body weight, indication, interacting medicine. This is what I'm meaning by moving from isolated facts to usable professional knowledge. So the OPRA exam is a very straightforward exam process than the previous CAPS exam. Previous CAPS exam has two portions. One is part 1 and the part 2. So part 1 and part 2 both had 120 questions around that, and you have to pass on both of the part to get the provisional registration stage. But with OPRA, it is simply one exam where you will have 120 questions and you'll be having 150 minutes to answer the questions. So which is around one and a half minutes. Sorry, it's around 1 minute 15 seconds, which is pretty much every question is allocated. But you will get some questions that may be answered within 20 or 30 seconds. Others may require a calculation, interpretation of a laboratory value, or careful comparison between similar options. A practical time management approach is first, answer straightforward questions confidently. Second, avoid spending several minutes fighting with one uncertain questions. Third is mark difficult questions and return to them after completing the remainder of the examination. The fourth, carefully read words such as most appropriate, least appropriate, correct, incorrect, not, initial, contraindicated, or first line. So this is a little bit cheat sheet where you have to focus on these words because these are the tricky part of the questions and that is directly related with that question. A candidate may know the clinical content but still select the wrong answer because they missed a single determining word. The result is based on overall performance against the examination standard. Candidates are not required to pass each content area separately. Previously, in CAPS exam, you have to pass, there are 4 components. You have to pass individually on each and every component. So if you have done really well in 3 part, but you haven't passed the third part, you still fail. But with OPRA, there is no requirement to pass individually on each portion. So what exactly is tested in OPRA? In OPRA, the therapeutics and patient care is the anchor domain. What does it mean that therapeutics and patient care is 45% of the questions will come from therapeutics and patient care. And this is the target domain where we should all be focusing if you are preparing for the exam. It includes the clinical application of knowledge from the other domains to patient care. Candidates should be comfortable with selecting appropriate treatment, identifying contraindications, precautions, recognizing adverse effects, monitoring treatment outcomes, medicine adherence, dose calculation, primary health care, special populations, pregnancy and breastfeeding, pediatrics, older people, renal and hepatic impairment, harm minimization, health promotion, confidentiality, and professional handling of medicine information. So all these is directly related with therapeutic and patient care. So if you spend a good time on therapeutics and patient care, you will be half covered to pass the exam. Biomedical science is 20%. This includes the biological foundations required to understand disease and treatment. Important areas include anatomy, physiology, pathophysiology, microbiology, immunology, biochemistry, and the biological basis of common diseases. Now, the next part is the pharmacology and toxicology, which is 15% of the content. And the pharmacology and toxicology, basically, it includes the mechanism of action, receptors, dose-response relationships, agonist and antagonist, medicine interactions, adverse drug reaction, toxic effects, overdose, and antidotes. Now, the next part is medicinal chemistry and biopharmaceutics, which is 10%. You need to know the functional groups, ionization, solubility, stability, formulations, dosage form, drug delivery, and factors affecting absorption and bioavailability. Then the pharmacokinetics and pharmacodynamics is 10%, where you need to understand the absorption, distribution, metabolism, elimination, clearance, half-life, volume of distribution, and steady state. So this is directly related with your therapeutic patient care. So if you study well with the therapeutics and patient care part, your pharmacokinetics and pharmacodynamics and pharmacology and toxicology will be very relevant to you. For me, if I was preparing, I would have, because therapeutics and patient care make up of 45% of the examination and overlap with pharmacology, calculations, and patient safety, I personally suggest allocating approximately 60 to 70% of your preparation time to clinically organized therapeutics and patient care practice. This is my suggested preparation strategy, not an official APC instruction. Do not completely abandon medicinal chemistry, biomedical science, or pharmacokinetics. A candidate who studies only clinical cases may still perform poorly because OPRA continues to include a substantial factual and scientific component. Now, theory versus practice, questions anatomy. In So in CAPS, when the CAPS was there, the question would have been asked in a way that what is the mechanism of action of enalapril? So it's basically a ACE inhibitor. So this is a factual knowledge. When you study your Bachelor of Pharmacy, we come to know the drug classification, drug groups, where we understand and we come to know about the different class of drug, which is a factual knowledge. But if it is the question in OPRA, it would have been a different style of the question. Is 68-year-old male, type 2 diabetes, hypertension, chronic kidney disease, EGFR has fallen from 45 to 25 milliliter per minute, and their current med is metformin, perindopril, amlodipine. And the question might be, which action is most appropriate? Now, we need to understand that we have to connect the disease and the medicine and clinical decision. So, this requires interpreting renal function, understanding drug precautions, and applying clinical judgment. In this scenario, for this patient, metformin dose needs to be reduced because their renal clearance, EGFR, has fallen from 45 to 25, which is a big shift on their uh, number. So the metformin dose needs to be adjusted. Your preparation should therefore contain three layers: know the fact, understand the fact, apply the fact to a patient. For every major medicine, prepare a small clinical framework, indication, mechanism, dose and administration, contraindications, common and serious adverse effects, clinical significant interactions, monitoring, adjustment for organ impairment, counseling, and place in therapy. Now, I'd like to discuss, like, there are few certain things that most of the candidates who will not have enough idea that what will be the OPRA preparation pathway and what sort of mistakes that can happen. It is something that we can understand, and if we can plan our study period and all of these together, we can overcome this situation. So the theory trap. Theory trap is basically if you keep memorizing drug facts without understanding clinical application, you will be a little bit confused when the question comes, because you have to understand that the focus on Australian pharmacy registration exam, OPRA, is based on the clinical application. So if you have a good theory practice, but if you don't connect the clinical application, it will be a very confusing. So my suggestion would be to connect the not only memorizing the drug facts, you have to understand the clinical application. Misallocated time, focusing heavily on medicinal chemistry while ignoring therapeutics. Because therapeutics is the largest portion, I would highly recommend to start with the process of getting the therapeutics and patient care more focused, like around 60 to 70% of your study time. And it will give you a good, strong base and foundation when you are in the exam. Then math deficits, if you don't give that much importance to the uh, calculation and other things, it's going to be a little bit difficult for you on the day of the OPRA exam. So I would highly recommend that you go and do some calculation every day so that it's much easier when the exam comes. Clock management, poor pacing across 120 dense case heavy questions in 150 minutes. And this is where you have to understand that there will be questions where you'll feel more confident and you can answer in 10 to 12, like let's say 10 to 12 seconds or 20 seconds. There will be some questions will be a little bit tricky where you might need 2 minutes. So try to answer the questions which you are confident, answer them first, then go with the calculations where you will need some extra time. But just don't spend too much time on each question. If you can't remember, just go to the next one. And whatever the questions that you feel comfortable, please answer them first. Now, lack of repetition, insufficient practice with complex patient case scenarios. So when you are start preparing yourself, you first think about preparing yourself with the complex patient case scenario, because when you get the patient case scenarios in your exam, it will be much easier for you to answer the questions. So the CAPS ask, the success formula is aim for 60 to 70% of study time dedicated to therapeutics and patient care. And mastering this 45% domain automatically covers pharmacology, calculations, and clinical reasoning. So if you heavily focus on this part, this will give you a lot of good, solid base in your preparation. So in caps, it was basically what you know, what do you know? And OPRA asked, how would you use that knowledge to care for a patient? So just don't memorize things, just try to connect uh, the factual knowledge with the clinical application. Depending on situations, you might have different case scenarios. So prepare yourself with your understanding and your if you focus on uh, your preparation based on the contents, it will be much easier for you to properly use your time for the preparation. Now, there are a few different Australian sources, which is very important. And if you can collect those sources, that would give you much more better standing, uh, which is called Australian Medicine Handbook, Therapeutics Guideline, Australian Commission on Safety and Quality in Healthcare Resources, TG approved medicine information, relevant Australian clinical guidelines, the official APC exam guide, and sample questions, which can be easily found on the Australian Pharmacy Council, where you will find the um, sample questions to get your idea about the exam questions, and also the guide, and it clearly explains what you need to study on each component. So you don't need to go for information to different resources. If you go and spend time on Australian Pharmacy Council website, it will definitely give you the best answer. Now, the interesting fact is when you become passing OPRA, then going through your internship, then getting your two other exam done, and then getting a general registration, the opportunities are really, really very good in Australia in terms of different career paths. So, pharmacist career opportunities in Australia, you can work in the community pharmacy. You can work as a registered pharmacist. You can be a pharmacist in charge. You can be the pharmacy manager. There will be professional services pharmacist where you will be providing services like vaccination and other things to the patients. There are few events, community health screening program run by the local pharmacy. Then pharmacy ownership is one of the option. Then you can choose hospital pharmacy, where you can work in the dispensary, clinical ward pharmacy service, emergency medicine, intensive care, cardiology, oncology, hematology, infectious disease, antimicrobial stewardship, mental health, renal medicine. So the opportunities in community pharmacy and hospital pharmacy is huge. There are different part of the program where you can work as a pharmacist. Uh, then you can be a credential pharmacist, a clinical credential pharmacist, where you need to go through a few different other graduate certificates and get yourself more into the clinical practice. And then you can work as a credential pharmacist that I work at now. And you can be aged care pharmacy, where you will be working and doing medicine reviews and quality use of medicine services to different aged care provider in Australia. You can work in the community as well, providing medicine reviews as a credential pharmacist, and you will be working closely with the GPs, and you can make a good rapport with the GPs, and you can provide services in the community. There is also general practice and primary care pharmacists, and you can work in a general practice, multidisciplinary medical centers, chronic disease clinics, diabetes service. You can be a diabetes educator. So diabetes educator is a individual profession where you need to be in a few different healthcare registered like pharmacist or nurse, and you can become a diabetes educator while you would be providing education service or management service, chronic management service to the people living with diabetes. You can work in the pharmaceutical industry, though heavily in Bangladesh, we always study to work in the pharmaceutical industry. But in Australia, it is heavily focused on the clinical part of the pharmacist pathway. It's not focused on the industrial pathway. You can also work in the government and regulatory careers, academic training and research, digital health and pharmacy informatics as well, which is a very interesting area where a lot of pharmacists now work in the artificial intelligence, electronic medication management system, clinical decision support, telepharmacy. Now, there is a big change coming where the pharmacists will be allowed in some certain minor ailment to provide medicine to the patients, which is called pharmacist prescribing. The first point is that pharmacist prescribing is not simply a future idea. Pharmacists are already authorized to provide particular prescribing or medicine supply services under state and territory legislation and approved protocols. A service that is authorized in one state may have different training, documentation, medicine, or practice requirements in another state. So this is the pharmacist prescribing, where you will be working along with the local GP centers or local healthcare centers, where in some certain minor ailment, you'll be providing your clinical decision and medication. This is a big change coming soon in Australia, and there is a lot of opportunity on this one. As a pharmacist in Australia, I'm very excited with this opportunity, and I'm really looking forward how it will help the rural and remote people, because if there is really lack of healthcare professionals, at least pharmacists can provide this prescribing service over there. So thank you very much, ladies and gentlemen. OPRA may appear difficult, but it is achievable with the right preparation. Begin with the official blueprint, build strong biomedical and pharmaceutical foundation. Aim to become a pharmacist who is ready to practice safely, communicate effectively, collaborate professionally, and place the patient at the center of every decision. CAPS was often described as asking, "What do you know?" OPRA increasingly challenges us to consider, do you understand that knowledge and can use it safely for a patient? Thank you, everyone. Now over to Dr. Samia Afrin.
Thank you, Mr. Zakaria Hossain. It was a brilliant presentation. It was very clearly explained about the OPRA exam, and you have described it very clearly step by step. And I'm pretty sure our participants will be benefited from your presentation today. Before we jump into our next session, which is a question and answer session, I would like to give Mr. Zakaria a really big appreciation for your presentation, and also give you a break for, I guess, just 30 seconds while I talk about some housekeeping stuff. So for our participants, please note that our presentation today is being recorded and it will be made available on our page. So you can later on, if you have missed part of it, you can always go back and watch it again. And I believe that this will be very helpful for your journey to get your career in Australia. Now we will start our question and answer session. We have got quite a number of questions, really. So we'll try to go through these questions as we have got them in order to that. If we can't answer any questions, or if you start getting some, new questions in your mind, do feel free to email to ABHF email address, which is on our page, and we'll try our best to answer that via email. So yes, Mr. Zakaria Hossain Bhai, you're ready to, bombard it with the question.
I'm more than happy to answer what I know.
All right. So our first question, it's a long one. I'll read it to you. Hi, I am a pharmacist from Bangladesh. I worked for 5 years after graduation before moving to Australia 3 years ago on a dependent visa while my husband was studying. Over the last few years, I have been focused on family responsibilities and settling into a new country. And unfortunately, I have not been able to pursue my professional career. I now feel lost and unsure where to start. My question is it still possible to restart my pharmacy career in Australia after this gap? What steps would you recommend for someone in my situation, and where should I begin?
Thank you, Dr. Samia. Thank you for your kind words about me and my presentation. I'm really happy. If it helps anyone, that would be like, more happiness for all of us. And that's why we are here. Now, the question has been asked about the gap. Now, I have my personal experience that I would like to share and encourage the person who asked this question, because coming from a migrant background, we always struggle in our first 5 years. That is a very struggling period. Personally, I had 11 years gap in between my coming to Australia and getting into the pharmacy. So if I can do after 11 years of gap where the whole world has changed, but still I pursued my dream and became a registered pharmacist, I believe that anyone can do that. The first thing is to come out from that understanding that, oh, it's already a gap. It's not a gap. It is just a time taken to enrich your knowledge. So just think in that way. What you can do is you basically start planning when you want to prepare for your OPRA exam. Take a little bit time, discuss with your husband as well, because when you study, you need to have a good quality time for yourself to study properly. And there are a lot of different resources that you can get to study, but I'm more than happy to discuss this. If anyone sends an email with their contact details, I'm more than happy to reply to them. So if they send email to ABHF for a pathway to start the study period, or how they're going to get preparation, I'm more than happy to answer that. But just letting you know that 3 years, 5 years, 10 years is not a gap. It is just time taken to understand and get some different form of experience. So you always can come back. There is no age limit, which is a good thing. And there is no limit how long the gap would be. As long as you sit for the exam, pass the exam and complete all the requirements, you can become a registered pharmacist in Australia.
Thank you for such an inspiring answer to that question, Zakaria Bhai. I'll go to our next question. What career pathways are available after registration? How can pharmacists become accredited for medication management review, in short, MMR?
Thanks for the question. So the first question was what career pathways. So when you have full general registration as a pharmacist, where you don't have any obligation to practice under a supervisor, you can explore career. So you can start normally. Everyone starts their career either in the hospital pharmacy or in the community pharmacy. And when they have a little bit experience, they like to choose depending on their own way of things. Some become university teachers, some work in the clinical research industry, some work in the pharmaceutical industry, someone goes to the medical liaison officer. Some people choose to go in different informatics, digital health. There are a lot of different part of the healthcare industry where a pharmacist work. Now it will be always your choice where you want to go, but first you need to get the general registration, then get some experience in hospital pharmacy and the community pharmacy, and then choose your own pathway where you want to further take your career. Regarding the MMR, medication management review, so you have to get your general registration, then you have to have at least 2 years of experience working in the hospital or community setting, and then you can do a 6 months course, which is called Medication Management Review Service under the Pharmaceutical Society of Australia. And you will be then, when you pass the course, there will be written questions, there will be assessments, there will be preceptor involvement on this. So when you pass that, then you will become accredited to provide medication management services.
Thank you for the answer. We'll go on to our third question. Is rural pharmacy a good option for overseas pharmacists?
Certainly, this is a great choice to start your career because in rural areas and remote areas, there is a still shortage of intern pharmacists. And when pharmacists are in their initial career stage in the general station, they always go, like I personally been to different regions uh, intern opportunity here. Yes, internship is a paid employment. There is a minimum wage that guarantees your wages that guarantees your payment, which is around $32 an hour at the moment, I believe. But that is just a personal view. It is not something that is not definite, but it is some sort of like a indication that where the salary is at the moment.
Yeah, I guess that sounds quite a good start, to be
It
honest.
is. It is.
So, our next question. Thank you for the webinar. Thanks to the organizers. You're most welcome. I am from Bangladesh, working here in a pharmaceutical company. My question is, can pharmacists apply while still working overseas?
Apply while still working overseas? Yes, of course, because the process is doesn't need you to pass the OPRA exam or appear in the OPRA exam, doesn't need you to be in Australia. There are, if you go to the Australian Pharmacy Council website, there are a list of centers where the OPRA exam is being held. So you can always look out on the Australian Pharmacy Council website and find the nearest test center and go and appear the test from there. So you don't need to be in Australia.
Okay, thanks for that. Let me know, Zakaria Pai, if you need a few seconds break.
No, no, I'm good. I'm good. Thank you.
All right, that's good. So, next question, Brother Zakaria. Very basic question. Which English test is preferred, IELTS, OET, or PTE? What scores are required for pharmacist registration in Australia? And another question is there any age limitation for job application?
There is no job application doesn't there is no age restriction on job application. There is the English requirement are changed in several times in last few years. So for the up-to-date information, you always look out for the Australian Health Practitioner Regulatory Authority website. AFRA is the short name. So AFRA and the Australian Pharmacy Council, on my webinar as well, on the speech as well, I said, please go to the website and get the proper information from there instead of asking anyone else, because that is the most legal outline of any English language requirement.
Yeah, and I might just add, like it keeps changing. They keeps changing,
That's right.
here and there. So you just have to be up to date with the information by yourself
That's right.
by checking the websites.
Yes.
Our next question, Salam Bhaiya, I am just fresh graduate. Please advise how should I start preparation for the OPRA examination? What study materials or resources would you recommend? Any coaching?
Again, the answer is pretty simple. If you go to the Australian Pharmacy Council website, it clearly states what you need to study from what part. So let's say therapeutic and patient care. It clearly explains over there what things need to be in the therapeutics and patient care, biomedical science, pharmacology. The Australian Pharmacy Council, their website is so resourceful that you can get all the information from there. And that is the perfect answer to any questions that you ask. From my understanding and my personal view, because therapeutics and patient care is the most prominent, like dominant part of the exam, so you focus on preparing yourself for that part, and go to the Pharmacy Council website and find out what mentioned there to study in the therapeutics and patient care. And it mentions about the reference books as well. But Australian sources like Australian Medicine Handbook, Therapeutic Guideline Australia are really good resource for study therapeutics and patient care.
Mhm. I'm just wondering, is there any sort of website or on the pharmacy's website that they kind of give examples of last year's questions or last year kind of,
They are not they are not like a
scenarios?
I do know that there are a lot of people say, oh, the recall and other stuff, but these are not like an authentic source of any questions or anything. So I don't want to mention any information which is not really authenticated information. So I prefer that the person who wants to prepare themselves go to the Pharmacy Council website and get the information from there. There are few different people who provides coaching and other things, but that is everyone's personal choice. We don't recommend any or endorse any website or anyone. Australian Pharmacy Council is the best site to get the informations.
And I guess we are not really advertising. We are just trying to help
Yes,
through this webinar
yes,
series to help people who want to come to Australia and pursue
that's right.
their career. So, and we are not really advertising for any coaching center or anything.
Mhm.
Our next question, can the OPRA exam be completed while living outside Australia? Is there any center in Bangladesh or nearby countries?
Okay. It is possible, and it is sort of like a really everyone's choice at the moment. From Bangladesh, there is no test center yet, but there is test center in India, there is test center in Nepal, Pakistan, Thailand, Singapore, Malaysia, and probably getting a seat into India and getting the visa is challenge at the moment. So Thailand and Nepal or Malaysia would be a good choice because there is not much Malaysian or Thailand or like people applying for OPRA. So most of the people are from Bangladesh going there to give exam, and also from India because India has 6 test center, but they're always full. So it is better to try with Thailand and Malaysia, and it is going to be a little bit challenging in Nepal and India.
And I guess you can plan for a holiday after your exam there.
Yes, that's right. That's right.
Our next question is a long one. I graduated and worked as a pharmacist in Bangladesh for several years, but after moving to Australia, I have been out of practice for 6 to 7 years. Will this negatively affect my registration prospects or employability? Next part of the question, I am now in my 40s. Is age disadvantage when pursuing the OPRA pathway and seeking pharmacy employment in Australia? The third part, how can I demonstrate currency of practice after a long break?
Okay. Because there is no age limit, as I said in my first question as well, there is no age limit. It doesn't matter what is your gap. As I said, I had 11 years gap, and it is not a mandatory that employer will choose you based on your age or anything. It is your capability, how you prepare yourself as a pharmacist. Your clinical knowledge and understanding is important. They will not see how old you are. They will not ask you even the questions. They will see how confident you are when applying your clinical knowledge. So if you prepare yourself well, if you prepare yourself clinically sound, then definitely there is a big employability opportunity. That's what I did. I focused on clinical application of the drug rather than memorizing the drug. That's how my employability got very high because when someone asked me a question, I try to answer clinically rather than memorizing the factual knowledge. But factual knowledge is important. At the same time, clinical application is important. So when you prepare yourself, make sure you prepare yourself to apply the clinical knowledge. So it will be an advantage.
It's very inspiring actually to listen to your story, Zakaria Bhai. We'll go on to our next question. What practical strategies would you recommend to improve the chances of obtaining an internship? If I complete OPRA successfully but cannot find an internship immediately, what should I do during that period?
So when you pass OPRA and fulfill your requirement for the provisional registration for the internship, if you want to stay within the metro areas, it is a little bit challenge because there are a lot of uh, candidates in the metro areas. But if you choose to go to a regional area for your internship, it is much easier. It will all depend on your circumstances. My suggestion is when you get the chance to finish your internship, you can always come back to metro areas back again with a full registration. Because when you get a full registration, your demand is everywhere. But until unless you get your full general registration, you are very limited. So wherever you get chance, please go complete your internship, and you are always welcome to the metro areas. So that is just a simple answer to that question.
Yeah. Our next question. This is our 11th question. Let me know if
No,
you
no,
need a break.
please carry on.
Is there still a workforce shortage for pharmacists in Australia, or is the market becoming saturated?
This is sort of like a question that I think it varies on a different side of the business of the pharmacy. Because the prescribing pharmacist opportunities are coming within next 1 year, there will be a lot of pharmacists, the senior pharmacists who will be moving to that part. There will be a vacancy in the lower part. It's like an ecosystem. So the senior pharmacist will go to the more clinical side of the pharmacy practice, where there will be an opportunity on the lower end of the pharmacy chain. So it's not saturated. It's not very high demanding, but it is a good prospect. If you can secure a position as your intern, most of the time the interns get job offer within the same organization that they completed their internship. And again, it is sort of like again, I said, if you can be if you can prove yourself, then there is no shortage of job. But if you cannot prove yourself clinically sound, there will be always shortage. So it all depends on you. You have to prepare yourself, whether you are employable or whether you are not employable. It's up to you. It's not an employer will decide or something. You have to understand that you have to prepare yourself.
Okay. Our next question. Which sectors currently offer the strongest career opportunities? Community pharmacy, hospital pharmacy, aged care, medication management, industry, or academia?
At the moment, hospital pharmacy has a big shortage, especially in the, I would say, little bit remote and rural areas. Community pharmacy also have a big challenge in the rural areas. In metro areas, there is no shortage of the community pharmacy or the hospital pharmacy, but there is big shortage in the remote and rural areas. So both the sector of community pharmacy and hospital pharmacy, there is limited opportunities in education and this part. But if you are looking to get into the hospital pharmacy and clinical pharmacy, my suggestion would be to go and seek out job in the rural and remote areas.
Yeah, and you can always come back.
Always come back. That's right.
Our next question. For someone supporting a family, is it realistic to pursue the pathway while working full-time in another job?
It all depends on you. If you believe yourself, and if you think that I definitely want to become a registered pharmacist on Australia, it is possible. I have seen a lot of people working full time, going back home, study 2 hours. I did the same thing. I worked full time. Still, I managed to study at least 1 or 2 hours. Even when I was in my break on my mobile, I was studying. So if you think and if you believe you can do it, you can do it. But if you are not confident or hesitant that whether I can do it or not, then it's going to be a little bit challenging. So first decide and then work on it.
And I guess it's worth giving it a go, isn't it?
That's right.
Our next question. OPRA focuses heavily on clinical decision making. How can candidates develop clinical reasoning skills if they have been away from practice for several years?
Again, you have to find out the proper resources where you can always, because your factual knowledge is there. When you study Bachelor of Pharmacy, you already got the factual knowledge. It is your, now you need to find the resource where you can connect the medicine to their clinical application. So your knowledge is there. You just need to reapply your knowledge and move away from factual to the clinical application. So if you go to, if you find the book Australian Medicine Handbook, that will give you a lot of understanding about therapeutics and patient care. If you go to the Therapeutic Guideline Australia TG website, you will find a lot of information. Then there is like, other resources like the consumer medicine information that easily available from the product's website. So there are a lot of different sites where you can get this information and upgrade your clinical knowledge.
Yeah, that's actually, yeah, very clearly answered. Thank you. Our next question. If a candidate has limited time, should they focus more on memorizing information or practicing clinical scenarios and questions?
First thing is that if you have a short time, doesn't mean short time, it doesn't properly gather the question into one piece. I believe if you are preparing, you should at least have 6 months, and 6 months is not a short time. 6 months, if you can properly utilize your time, if you spend 3 months on patient care, pharmacology, toxicology, that will give you, and pharmacokinetics, that will give you a good preparation start. And then the other 3 months, you can go with the, but with that first 3 months, you have to be more clinical rather than factual knowledge. So you need to understand the context of the medication. You need to understand why it's been used, what is the contraindications, and all of these. On that 3 months, it will give you enough time. But if you just say, "Oh, I'm gonna sit on this September," I believe someone starting now and going for the September is not a good idea.
And as you said before, the exam before was more sort of knowledge based, and now it's more sort of clinical scenario based. And you even give the example of the blood pressure medication. So I guess it's very clearly like, you just got to be planning and then going on action on that plan. And you will
That's right.
need a good period of time for that. Our next question. Can you please share what was the most difficult part of your own journey? English exams, internship, or finding employment? What advice would you give to candidates attempting the exam for the first time like me?
Okay, so to be honest, when I decided that I want to come back to my own field of pharmacy, and that was my only aim, I prepared myself. My challenge was to, coming back after so many years where the whole things got changed. I have started myself. I have organized my time. I have planned myself what I'm going to study from what time. I took around 7 months by myself to prepare myself and then went for the exam. Finding when I finished my registration, yes, the English exam was not challenging. I was overconfident. So the first time I failed in the writing part because I could speak. So I thought that I could write as well, but my writing was not good. The second time it went well and I got my registration. Finding a job, I was in Melbourne. So it was not a challenging for me. I got a job opportunity in Metro pharmacy. But then when I wanted to further enhance my career into more regional areas, I choose Young. I worked in Young, so that was a good place to work for any pharmacy. You will come to know a lot of about the, and then I did my medication management review courses and then diabetes education courses. So uh, I never I never felt that I'm being challenged because I already decided, and when I decide something, I always achieve that. That's me. So it depends on your circumstances. So if you believe something that you want to do it, then go for it. But if you are not confident about it, then it's challenging. But for me, I was confident that I will definitely do it, and that way it was not. I never felt challenged.
That's great. It's very inspiring, I must say. Our
Thank you.
next question. How many times one participant can sit for the OPRA exam?
There is no limit that how many times you can sit, but the problem is it is heavily cost involved. So every time you sit, you have to spend money, and depending on your situation, you can sit as many times as you want. But my suggestion is don't go think like that. Think that okay, I will prepare. Instead of 6 months, you can take 1 year, but take enough time, prepare yourself, and always think that I'll definitely pass in one go. So don't think that like I'll go for one time and then go for the second time on the third time. Take more extra time rather than sitting every time because it's going to waste your money. Take extra time, prepare yourself, go for the first time, and you will be successful, inshallah.
And I guess doing it a few times will actually impact on your confidence level as well.
That's
And you
right.
don't want to actually have that impact.
That's right.
Our next question. Is there any CGPA requirement for being eligible for OPRA exam?
There is no CGPA requirement. Australian Pharmacy Council basically assess your education compared to Australian standard. So if you graduated from a university, then definitely you have to have a minimum CGPA. And Australian Pharmacy Council is the final authority. I'm not the decision maker, but CGPA doesn't have any involvement of the eligibility check.
Okay. And our lucky last question. Is OPRA exam mandatory for industrial pharmacy regulatory career? Also, please highlight all non-licensed pharmaceutical professions.
OPRA exam, industrial pharmacy and pharmaceutical doesn't need a registration. So, an industrial pharmacy, pharmaceutical, industrial pharmacy is not in Australia. It doesn't called as an industrial pharmacy, but in Bangladesh, it is called industrial pharmacy. So, getting a job in the pharmaceutical industry doesn't need you to have a registration. They don't have any registration criteria. You can be a science graduate from any discipline. So you can be a biomedical science, or you can be a physics or chemistry or anything. You can work in a regulatory career. There is no requirement. OPRA exam is not mandatory because OPRA is the pathway to get your general registration. It is not a way to get a job in the industrial pharmacy, regulatory, or career. And highlight all non-licensed pharmaceutical professions. Uh, I don't have much idea about the other part of the pharmaceutical profession where you don't need a licensing. Probably it's better to have a look on the SICK career website and find a little bit understanding, but I'm more into the registered pathway, so I have understanding. But industrial pharmacy, any regulatory job or any career related to that doesn't need you to be a registered pharmacist. Only if it is required a registered pharmacist, then it will mention on the job advertisement. But if it doesn't say anything, then it doesn't need that.
Okay, thank you. I guess that brings us to the end of our webinar tonight. For our participants, as I mentioned before, we will upload the live video on our official page. And if you want to have any question like based on your situation, you can always email to ABHF email address. And I'm sure Mr. Zakaria Hossain Bhai is really enthusiastic and he will respond to your questions.
Inshallah, inshallah.
I would like to conclude our webinar here tonight. Thank you so much, Mr. Zakaria Hossain Bhai. And thank you for all our participants to join our webinar. And I hope that it has been and it will help you to pursue your career as a pharmacist in Australia. Thank you, everyone.